Welcome back to part 2 of the webinar for Child Development Homes. Also starting October 1st, 2016, Child Development Homes must complete a pre-service health and safety training course that has specific training topics that are identified in the federal law. The topics covered in the pre-service training include prevention and control of infectious disease, prevention of sudden infant death syndrome and safe sleep practices, administration of medication, prevention of and response to emergencies due to food and allergic reactions, building and physical premises safety, prevention of shaken baby syndrome and abusive head trauma, emergency preparedness and response planning, handling and storage of hazardous materials, and precautions in transporting children. Iowa has also chosen to include information on working with children and families of diverse backgrounds and families experiencing homelessness as they relate to other requirements in the new law. In Iowa, we are using the title Essentials to refer to the series of courses that is being developed to cover the pre-service topics. This training will be available for free, online or in person. This module-based training is in its final stages of development with our partners at Healthy Childcare Iowa and Iowa State University Extension and Outreach. Here is a sneak peek of one of the handouts offered with the modules. As soon as it is available, the department will share more information with you about the training. Additionally, all DHS field staff who are completing monitoring visits will be required to complete the same health and safety training course. This pre-service course will provide a foundation of basic health and safety information that all child care providers should be aware of. The course being developed covers all of the topics in 12 hours, so it will be the basics of each topic. You may find that you want to seek more in-depth classes about some of the specific topics after taking the pre-service training. In the future, other child care professional development agencies may develop courses that cover the pre-service topics. The department will have to approve any courses that count for the pre-service requirement, so be sure to verify that a course counts for pre-service before taking it. Now let's look at how the pre-service training will be handled once it is available to providers. For providers that submit a new registration application on or after October 1st, 2016, they must complete the pre-service training before becoming registered. Verification will need to be provided during the application process before a registration certificate will be issued. Current providers will fall into two groups based on when their registration renews. Group 1 is providers that have renewal dates between October 1, 2016 and September 30th, 2017. They will need to complete the pre-service training before renewing their registration. Group 2 is providers with a renewal date between October 1, 2017 and September 30th of 2018. They will need to complete the pre-service training by September 30th, 2017. As a registered provider, if you have not completed the pre-service training by September 30th, 2017, you may have your registration revoked. Both providers and their approved substitutes will need to complete the pre-service training course. The Essentials pre-service training will be free for both child care providers and their substitutes. Any substitutes added on or after October 1st, 2016 will have 90 days from time of approval to take the pre-service training. However, the substitute cannot be used until he or she has taken the training. The new federal law identifies specific areas that must be in emergency preparedness plans. The plans must include procedures for evacuation and relocation of children, shelter in place, lockdown, communication and reunification with parents or other adults responsible for the children, continuity of operations, and procedures to address the needs of individual children, including those with functional or access needs. This requirement is effective October 1st, 2016 also. The pre-service training will provide basic information on creating emergency preparedness plans. Also, DHS is currently collaborating with key partners such as the Iowa Department of Public Health, Healthy Child Care Iowa, Child Care Resource and Referral, and the Office of Homeland Security and Emergency Management to provide guidance and suggestions to providers for developing emergency preparedness plans. A planning guide that will have an emergency plan template and tools and letters that you can use and adapt to your program is being developed. You are not required to use these specific forms and templates. Once the planning guide is finalized, we will provide it to our child care resource and referral partners who can distribute it to child care providers. We are also sharing information about the new requirements for child care providers with county emergency management coordinators. Child care resource and referral, child care nurse consultants, and county emergency managers are great resources as you develop your emergency preparedness plan. The law also requires professional development and training requirements to improve the knowledge and skills of the child care workforce. One part of this requirement is a progression of professional development opportunities. Early Childhood Iowa has already developed a pathway that helps professionals in the early childhood field understand the career opportunities available to them and the recommended training for each option. Recently, an interactive web-based tool was developed to make this information more accessible to the child care workforce. The pathways can be found at www.ecieducationpathway.org. Let's take a quick look. On this website, you can answer questions about where you are today. You can look at options available in the early childhood field and make a plan for where you want to be. Additionally, a group of stakeholders has been assembled to give input on further trainings that could be relevant to staff that work with school-age children. Another requirement in the law that Iowa already had in place is early learning and development guidelines. The Iowa Early Learning Standards, most recently revised in 2012, are a resource for child care providers, parents, and others who care for or work with children. These standards describe the knowledge, behaviors, and skills from birth to 5 that children can demonstrate. Knowledge and understanding of these help adults to support and enhance children's early learning and development. A link to access and print these standards can be found on the Early Childhood Iowa webpage at www.earlychildhoodiowa.org. The final area of changes this webinar will highlight is consumer education changes. The federal law has a focus on promoting family engagement through consumer education. To help parents make informed child care choices, the new law requires Iowa to make consumer education resources available electronically. DHS will provide this information to families and the public on the department's website at www.dhs.iowa.gov. Requirements include posting specific information such as the results of monitoring, inspection, and complaint reports, and what background checks are required for child care providers. Iowa must also provide information about the process for registering and monitoring child care providers and annual data on the number of deaths, serious injuries, and instances of substantiated child abuse that happen in child care settings. Let's take a quick look at where this consumer education can be found. If you go to the main DHS webpage and click on Can We Help?, there is a heading for childcare. Once parents are on the childcare page, there are multiple menu options on the left-hand side of the page. The Tools and Resources page offers parents numerous sources of information on childcare and on child development. If I click on the Compliance and Complaints Report link, it takes me to a page where I can search for reports on a childcare facility. I can search for reports by name, provider ID, type of facility, county, and city. The Department of Human Services hopes that you have found this webinar on changes coming to Iowa's childcare system helpful and informative. We want to thank you again for your efforts in providing safe, caring, nurturing, and engaging learning environments to the children of Iowa. There is a frequently asked questions document available on the Iowa Child Care Resource and Referral website that may answer some of the questions you have. If you have additional questions, please start by contacting your local Child Care Resource and Referral office. Also, if you are not signed up to get emails from the Child Care Resource and Referral agency nearest you, we recommend that you sign up so that you get the most recent updates, information, and resources available. Contact information can be found on their website at www.iowaccrr.org or by calling 1-877-216-8481.